Hi, I'm Bob Schrupp, physical therapist.
And I'm Brad Heineck, physical
And
therapist.
together we are the most famous physical therapists on the internet.
Well, now, opinion, of course, Bob.
Brad, we're doing something completely new today.
And this
Julie's
is
going to be part of it.
And this is exciting.
This is exciting, yeah. We're breaking new ground here. Julie kind of is helping, she works with us, and she was telling us today that she's having some vertigo, some spinning. You lose your balance, right? I mean, you're kind of worried you're going to fall over.
Yeah,
right?
if I move fast, yes.
So we're going to go ahead and do a quick test on her to see if she maybe has BPPV, benign positional paroxysmal. You always say it differently.
Yeah. Vertigo.
Vertigo. To see if she has vertigo. We're going to see if she has the most common one. So we're going to do what is called the Dix-Hallpike Maneuver on her. And we're going to see if she has a little bit of dizziness here. So Julie, why don't you come over here? You're going to scoot back a little bit further right there. Now, we already, to be honest, we already did one direction off of camera. We turned her head this way and then we brought her back. Now, and she got very dizzy with that, so we're going to try the other direction to see if she gets dizzy with that also. I think I'm going to have you take your glasses off. So we're turning her head 45 degrees to the left, and then I'm going to go ahead and bring her back really quickly here. You ready? Mm-hmm. Okay, Julie, come on back.
No. I'm not dizzy this time.
And she was very dizzy when we did this the other direction. So we now know which way we have to go. So why don't you come on back up. So when I turned her head this way and I brought her back, that's when she really started spinning. You didn't get nauseated, but you got very much spinning.
She needed to hang on to something when she was still
right.
Not lose her balance.
So we're going to go ahead and do the Epley Maneuver on her here, which we have a video on it already, but we're going to go ahead and do this to see if what's going to happen here, so you can see it happen on a live patient. So again, she's going to tilt her head 45 degrees to the left, and then when I bring her down, we're going to have it tilted back 20 degrees. So
45 to the right or to the left?
45 to the right. What did I say?
Left.
45 to the right, and then tilt her head back 10 degrees. Okay, here we go, Julie. You're not going to like this. Okay, and watch her. Look at her eyes, Brad. See what her eyes are doing?
Oh yeah, her eyes are twitching back and forth. They call that nystagmus.
Yeah.
I'm timing here. We got about 15 seconds.
We're waiting until the eyes are calming down, and now they're calming down. Do you feel it kind of going away?
Yep.
And now I see nothing. Do you feel like it's gone away?
Yep.
Okay. Now I'm going to tilt her head this way. Again, 45 degrees to the left, 20 degrees down. And no symptoms at all?
No, not too much.
A little bit?
Yeah. Just after you turned it a little bit, it's okay.
So the idea is we're going to wait until the symptoms
go away, or 20 to 30 seconds.
Okay.
Okay, now I'm going to have you roll over onto your shoulder.
Which way?
To your left.
Towards
And
me.
we're going to keep your head down. You bring your head down like this. All the way down. Good.
Okay.
How you doing?
Okay.
Are you getting symptoms now?
Nope, I did a little bit when I rolled, but
Okay.
you know.
We'll wait a few more seconds just to be sure. Boom, 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 boom. Okay, let's come on up. And we'll keep her head turned. Okay.
Yeah. It's a little bit dizzy.
A little bit dizzy?
Yeah.
You can see it on her eyes. Boy, her eyes were really going on that first one. Still?
A little bit.
The room spinning or?
No, it was just a little bit dizzy, not like before. Then it was definitely spinning. Now it's pretty good.
Good. I'm going to go to the middle. Now, for the rest of the day, you can't look down at all. A lot of times we'll have people maybe wear a neck brace, or I take sometimes a rolled towel and just pin it there. And and just to remind them not to look down, and believe me, they will forget, because
it's natural.
I had a lady the other day, I'm not kidding, 10 seconds after I told her, she reached down and grabbed her purse. And I repeated it like 10 times, do not look down.
Right.
And she went down and looked at her purse. So you can look down with your eyes, but you can't look. And then tonight, you want to sleep on a bunch of pillows if you can,
Right.
kind of elevated, and do that for one night, and then tomorrow you can do whatever you want.
Okay.
Okay? So,
What I always do, I just tell them to go to the not hardware store, go to the drugstore, the pharmacy, and buy a soft cushion collar. They cost about $10 or $15, and just bring it along, because there's gonna, you know, just to prevent it. And I put it on right now, and then they walk out with it.
to be honest, I would possibly even do it again on her, because she had little symptoms coming up, but I think we'll try it without.
Okay.
But we may have to redo it. I think it's like 20%, you have to redo it another time. But, you know, the results are usually fairly dramatic. You usually get rid of it a lot of times with one setting or two settings.
And how long does she need to keep her head up
Yeah.
without looking down?
Till tonight.
Okay.
All the way till she goes to bed.
Okay.
And then tomorrow morning she can look down again.
And we've got another video where we're saying 48 hours.
Right, and that's what it used to be, and now they're recommending that you can do it just till the end of the day.
Right.
So.
But we've had people call and say they've had success only if they did 48 hours.
Right,
so.
I have had people that have said that to me, but it might have been the fact that they just did it the rest of the day.
Right.
You know what I mean?
Sure.
So
Yeah.
we don't know, so.
Okay.
Thanks, Julie, we'll check on you to see how it goes, but we may have to redo this if it doesn't hold,
Okay.
so.
Don't shake your head up and down.
Yeah, that's
all right.
Just say okay.
All right. Thanks a lot.